Good evening, friends. I'm Dr. Aajay Shah, and this is our other Facebook Live. I've been doing this Facebook Live on a regular basis for last few weeks as we have a lot of time at home, as we are in lockdown with COVID-19. I think it makes sense to utilize this time to our growth. I always say that all struggle should turn into growth, and this COVID-19 crisis or Corona crisis, we should be actually growing. And for that reason, I've been giving this regular Facebook Live on various topics, including health, happiness, stoicism, how to grow, and other areas. Today I'm bringing one of the 6 pillars of healthy lifestyle. There are 6 pillars of healthy lifestyle. Eating is the most important pillar. Exercise is the second pillar. Sleep is the third pillar. Substance abuse is the fourth pillar. Stress management is the fifth pillar. And relationship is the sixth pillar. So there are 6 pillars for healthy lifestyle. Today we're going to talk about substance abuse. Substance abuse is a major concern in our country, and that's the reason it's considered one of the important pillar. The major substance which we abuse or overuse is alcohol. Actually, alcohol is the most legally abused substance. Alcohol is very commonly used and commonly drank. 70% of Americans have one drink within last 1 month. So 70% of Americans drink alcohol. 6 to 7% of Americans have 5 drinks within last 1 week or more. That means about 6 to 8% are alcoholic, which is pretty high number. 30% of teenagers had a 1 drink within last 1 month. So a lot of teenagers also have alcohol problem. When it comes down to alcohol, 0 alcohol is the ideal amount of alcohol, 0 alcohol. Obviously, if you like to have a once in a while drink at a gathering or at a restaurant, or if you are out, then having a 1 glass of wine is a fair call. Even when we look at the blue zone people who live long, happy, healthy, they also have once in a while alcoholic drink. But it's a drinking 3-4 drinks every night, that's when it creates a problem. So again, 0 alcohol is best, but if you have once in a while glass of wine, once in a while hard liquor, once in a while beer, I'm not against it. Matter of fact, I myself once in a while have it. So again, it's the amount of alcohol you drink, not once in a while alcohol. So what are the negative effects of alcohol? Alcohol actually has multiple negative effects. Let's start one by one. Number 1, when you drink alcohol, it increases your appetite. So you end up eating a lot of extra calories. And those extra calories many times are empty calories because they're typically unhealthy food. Alcohol itself is an empty calorie substance. It doesn't have any nutrients, doesn't have any micronutrients or any other vitamins or anything like that. So alcohol itself is an empty calorie, and when you drink alcohol, you also have additional calories. Alcohol affects your sleep. It may put you to sleep, but the quality of sleep after an alcoholic drink is very poor. Lots of less deep sleep and lots of less REM sleep. So again, alcohol may put you to sleep, but it's not the right kind of sleep you want to get. Alcohol obviously make you more prone to accidents. Drunk driving and killing innocent people has been very common, unfortunately, and we need to stop that. Alcohol will lower the productivity. People have a lot of hangover. We all have gone through once in a while experience that when we had a few drinks, next morning we were not productive as we would be. Alcohol can cause fatty liver and cirrhosis, so it deposits the fat in the liver, and that eventually can lead to cirrhosis. Matter of fact, now the commonest reason for liver transplant is now fatty liver. Typically, fatty liver happens because of obesity, but alcohol plays a role also. Alcohol can cause high blood pressure. I've seen many of my patients whose blood pressure is not coming under control, and that's partly because they have excessive amount of alcohol and they drink every night, 3 to 4, 5, 6 drinks every night, and blood pressure is not coming under control. So if you have a high blood pressure, if your blood pressure is not coming under control, consider stopping alcohol or lowering it maximum no more than 1 drink per night. Alcohol can cause atrial fibrillation, which is an irregular heartbeat from the upper part of the heart. Alcohol can also cause stomach bleeding and bleeding in the bowel. So again, alcohol can cause significant bleeding issue also. Alcohol, obviously, if drank in excessive amount, can also lead to death. So it's a very dangerous substance. Alcohol also has been shown to cause many oral, like mouth, stomach, and other cancers. Matter of fact, it's proven that a woman who drinks a glass of wine every day has about 25% higher chance of breast cancer. So again, alcohol drinks also is associated with having higher number of breast cancer. Alcohol can obviously cause tremors of the hands. Alcohol can also lower your sexual inhibition, and many times alcohol-induced rape and other issue becomes a major concern also. Alcohol can also cause pancreatitis, which is the inflammation of pancreas, and that can lead to major life-threatening condition. Alcohol can also cause infertility. Alcohol can cause diarrhea. Alcohol can cause hallucinations. Alcohol also has been shown to cause osteoporosis. Alcohol also can affect your cerebellum, which is the part of the brain in the back of the brain, and that can lead to many times balance issue, ataxia, and having difficulty in walking in a straight line. Alcohol can also lower your immunity. Alcohol can cause erectile dysfunction. Alcohol also will increase the visceral fat, which is shown to cause many chronic disease, including diabetes, heart disease, Alzheimer's disease. Alcohol can also cause bone marrow suppression. Matter of fact, many patients we see have a low platelets and low white count and low red count, and that's because of alcohol can affect the bone marrow. Alcohol will also come in the way of gaining muscle mass. So I've told many patients who want to gain muscle, who want to be athletic, that if you drink heavy alcohol on a regular basis, you'll have difficulty in gaining the lean muscle mass. So again, alcohol can come in your way of athletic ability. Alcohol actually, matter of fact, also can cause cardiomyopathy, which is the weakness of the heart muscle, and can put you into heart failure. I have seen many patients in my cardiology practice that because of heavy alcohol use, people go into heart failure and weakness of the heart muscle, cardiomyopathy. Alcohol obviously can cause many mental illness, including depression also. So again, alcohol is a major issue, has probably 50 bad things it can do. It should be no more than one drink per day, no more than once or twice a week. Definitely not having 3-4 drinks 3-4 times a night. That's absolutely not the right thing to do. If you enjoy once in a while drink in a company, I understand that. So if you have alcohol concern, alcohol problem, what you do? Number one, recognize that you have an alcohol problem. You drink a lot. Number two, seek help. Talk to your primary care physician. You can get also help from several groups, including Alcohol Anonymous. And definitely you should read about all the side effects of alcohol. Like this video itself lists all the 20-30 side effects of alcohol, but you should read about how bad the alcohol is to your body, and you will have a better idea why you should stop drinking alcohol. So again, we talked about alcohol. Number one, abused substance in America, alcohol. The other substance is the nicotine or smoking. Fortunately, smoking incidence has gone down now. When I came to this country, about 25% of people were smokers. Now it has come down to about 17%. So definitely smoking has gone down. But knowing that the smoking can cause so many medical issues, including lung cancer, smoking should be 0%. Obviously, hopefully it will come down to 5-10% in next 10 years. But again, smoking is the second most commonly abused substance. 17% of people still smoke. And I've seen still many cases of lung cancer because of smoking. So again, if you unfortunately have a smoking habit, talk to your primary care. There are a lot of medications available to quit smoking, and you definitely work hard and you can quit smoking. The other substance, which are obviously some of the street drugs, including heroin, cocaine, and some of the hallucinogens. Also, marijuana is also another abused substance, which unfortunately is legalized in many states, and there also should be capped at a minimum or should be avoided as much as possible. And the last thing, which is unfortunately involves medical professionals, is the prescription drug abuse. Obviously, you've been reading in TV and newspapers that a lot of prescription opioids has become a major issue. For example, in Ohio, and a lot of the doctors were at fault also. They were prescribing some of the opiate prescription drugs right and left, just like candies, and that has led to many opioid dependence, opioid addiction. Matter of fact, last 3 years, the average lifespan in America has gone down, particularly because of young people dying, and the main reason is the opioid addiction and opioid substance abuse. So again, because of opioid, we actually are losing our lifespan, average lifespan in America. So again, we have talked about all these substances. Alcohol is number one, smoking is number two, prescription opioid substances are number three, and so the street drugs are number four. Try to avoid all of them, obviously. Alcohol, like I said, if you are once in a while, I understand that. Smoking should be zero, in my opinion, and all other drugs should be zero. So again, I've covered this substance abuse in about 10 minutes. I'll be doing more regular live over the next 4 to 6 weeks. This video will be on YouTube in a few days. So subscribe to our YouTube channel, Healthy Living with Dr. Aajay Shah. I already have put some videos on YouTube channel. One of them is about sleep. So if you have a sleeping problem, go out to our YouTube channel and watch that video, and you will definitely get a good sleep tonight. If there's also video on happiness, which is obviously appropriate time right now. A lot of us are going through much stress and much anxiety right now, that how to be happy even in a crisis time. It's a good video. It's about 15 minutes long. So reach out to our YouTube channel, subscribe to it, and watch those videos. I'll be doing another live tomorrow. I hope you like this video. Share if you can. Thank you.